Hi, my name's Rohan. I'm from Leadership Initiatives. I'm an intern here, and I was hoping if I could ask you a couple questions to help diagnose you today.
Thank you, Rohan. You can go ahead. Dr. Hamza Yusuf, I'm going to be your guide. You can ask all the questions you want, okay?
Okay. Hi, so what's your name?
Right, Miss Sunanta.
Could you say that again?
Yeah, she said her name is Fatima Mukhtar.
Okay. And so, where do you live?
Right, and I could be Zama. Eh? Zango? Okay, they live in an area called Zango in
So,
Bauchi State, northeastern part of Nigeria.
hmm. And what brings you into the hospital today?
Wai me ya kawo ku yake damunta? Ya me kuma? Anana. Okay, she's been having this fever for the past 4 days with associated abdominal pain and vomiting.
Okay. And is this fever continuous or is it on and off?
Um, um, wai wannan zazzabin yana nan ko da yaushe ne ko yana zuwa ya ɗauki. Okay, the fever is actually on and off, comes and goes.
Okay. And about the abdominal and stomach issues, is there any constipation, diarrhea, any more like, and also could you ask if the abdominal pain is on a scale of 1 to 10, what it is?
All right. Wai wannan ciwon cikin idan aka ce misali maki 1 zuwa 10 ne, 1 shine yafi sauki, 10 shine yafi tsanani. Kamar makin ciwon cikin ta nawa zaki bayar? Eh? 3. Ba sosai bane sosai. Amma akwai gudawa ne ko akwai wani abu daban? Okay. Okay, she said the abdominal pain is actually mild. She'll give it a 3/10.
Okay.
And there are not any loose stools or constipation.
Okay. And where you live, is there any still water?
A inda kuke zaune akwai irin kamar ruwa da baya gudu ne, kamar ko kwata ko rijiya ko ɗan kududdufi? Eh? Babu. They actually don't have any stagnant water in their home,
Mhm.
and their home is not surrounded with bushes. However, they have some mosquitoes around their home.
Okay. Okay, mosquitoes. And
Mm.
is the patient's skin fair, yellowish, yellow eyes?
Okay. Wai kun ga kaman hannunta ya ɗanyi kaman ya ya yi haske ne sosai ko kuma idanta ya ɗan yellow ko na abu. She actually, the mother had not noticed any paleness of the palms or soles or any yellowness of the eyes.
Okay. And a couple more things. Does it how is the diet? Is it nutritious? Does it feel weak when to stand up?
Okay, wai yanzu misali abincinku mafi akasari mene abincinku da ya fi kasancewa? Mm, kenan. Okay, they said the diet actually consists mainly of carbohydrates, mainly rice as the
Hmm.
main staple. Then they can also have pasta sometimes,
Okay.
or maize gruel. They hardly have any meat or any vegetables.
Okay. So no meats and no vegetables?
They do, but occasionally.
Okay, occasionally. And is there any coughing? Is there any coughing at all?
Okay, well, akwai tari ne? There's no cough actually.
No coughing.
Yeah.
Okay.
Do you want to ask if they actually use any mosquito nets or if
It,
their source of drinking water or something
uh,
like that?
is there any use of mosquito nets or and how is the drinking? How do y'all drink? Is it contaminated water or clean water?
Good. Wai a gida kuna amfani da mosquito nets ne ko kuma kuna amfani da net? Lallaɓa kusa ana kallon abin. Okay. So, bata ta zauna a ƙasa, bata mana. Hmm? So, wai kuna ruwan sha fa ina kuke samun ruwan sha? Famfo? Okay. Kuna tafasawa ne? Okay. They actually don't use any insecticide mosquito nets. However, they usually spray box spray,
Mhm.
and their source of drinking water is from tap, but they
Mhm.
don't usually boil the water before drinking.
Okay. Um, so I just allowed to make a diagnosis or just keep going.
Do you
Okay.
want to ask if you want to us to run some investigations for your patient?
Could you repeat that, please?
Do you want us to run any blood test for your patient or something?
Yes. Okay. For the, could you run an rapid diagnostic test?
Okay, perfect. We actually did a rapid diagnostic test for malaria for the patient that turned out positive,
Hmm.
and we also did a blood film that showed two classes of malaria parasites.
Okay.
We also did a complete blood count that showed a hemoglobin level of 9 grams per deciliter.
Okay.
Yeah,
And for the, so for the treatment plan for the malaria and the anemia, you can give ACT for malaria, and for anemia, you can give oral supplements to better their nutrition.
perfect. So wai saboda yana tunanin tana da malaria, za a ba ta maganin malaria ECT, sannan kuma za a ba ta iron supplements, iron tablets, saboda ya sa jinin ta ya ɗan ƙaru. Ko? Yeah. So I've explained the treatment to the patient,
Mhm.
and they are actually satisfied and they are going to comply with your recommendations. But do you like to talk to them about any other thing else? Maybe like some preventive measures or something?
Yeah. Mhm. So to prevent the malaria, an easy way to do it is, if possible, anyway, try to get a mosquito net. I know it can be hot when you sleep inside of it, but it is really helpful as during the night you're not conscious, and so sweating the mosquitoes won't like shoo them away. So having a mosquito net while you sleep is very important. And for the anemia, try to have a balanced and full diet if possible, or try to have enough meats, veggies, fruits to have the type of vitamins you need to like be healthy.
Great. Wai yana so, saboda ta kare kanta daga malaria, ana kwana a mosquito nets, sannan kuma ana amfani da maganin sauro, sannan kuma tana cin abinci mai kyau kamar su nama saboda da jinin ta ya ɗan farfaɗo. Ko? Yeah. So I've explained everything you said to your patient, and they have actually understood you clearly, and they're going to try as much as possible to comply with those recommendations. So is there any other thing else you'd like to tell your patient?
Uh, one last thing, make sure you get enough food, water, and rest to like recover and get a full recovery.
All right. So we're gonna have some chatting social therapy. Well, all right. So you can wave your patient goodbye if that's all you have for them. Okay.
Okay.
But then before then, I like to personally commend you for a very wonderful performance. I feel like you're very confident and you're straightforward. You ask the right questions and you're able to actually make the right diagnosis. So congratulations for wonderful performance, and you should be proud of what you've done. Okay?
Okay, thank you.
All right. Bye bye.
Bye bye.